Patients come to me wanting a facelift and they're not really sure what it entails. There's a lot of gimmick out there as to what a facelift is. There's this type of facelift, a lunchtime facelift, a vampire facelift, but essentially a facelift is rejuvenation of the lower half of the face as well as the neck. Now, nobody really wants a facelift, right? It's an admission that you're getting older. But if done properly, it results in a dramatic transformation. So some people are nervous about getting a facelift because they're really scared of looking overdone. And so there's some things that are telltale signs of being overdone. Number one, they're overpulled. The skin looks a little bit too stretched, a little bit waxy, and that's because there's just too much pulling of the skin. This is not a pulling surgery, it's a redraping surgery. Number two, it's called a pixie deformity. And what that means is there's so much tension on the closure that it actually pulls down the earlobe to make it look like a pixie ear, that it's attached to the face. And number three, the scars can become widened or thickened. And that's also, again, because there's just too much tension on the closure. But it can really inhibit how people wear their hair. Women can't put their hair up in a ponytail. Men have to wear it longer to cover the scars. So these things do not happen in my hands. Number one, because I'm very technical about how I close. I'm judicious in how much redraping, and I have a fine arts background to really balance all of these things, the technical aspects of the surgery and the artistic aspects of the surgery. Recovery from a facelift surgery is a lot easier than many people think. They come back to the office at 1 week for suture removal, and most patients are back to work within a week. And by 2 to 3 weeks, they're well on their way to looking great. And by 4 weeks, they're back exercising, and they're really starting to enjoy their new rejuvenated face.